Summary of the body. Keeps the score, Brain, Mind and Body in the Healing of Trauma by Bessel van der Kolk. 1. Understanding the effects of trauma on the brain and body. This passage discusses the author's personal journey in understanding the complexities of trauma and its effects on the human mind and body. The author recounts their fascination with the intricacies of the human body at a young age, and how this curiosity led them to question the lack of knowledge in the field of psychiatry regarding the origins of mental health problems. The author highlights the birth of 3 new branches of science: neuroscience, developmental psychopathology, and interpersonal neurobiology, which have provided a wealth of knowledge about the effects of trauma on the brain and body. Research from these disciplines has revealed that trauma produces physiological changes in the brain, leading to increased stress hormone activity and alterations in information processing. These changes explain why traumatized individuals often exhibit hypervigilance and have difficulty learning from experience. However, the author also emphasizes that this increase in knowledge has opened up new possibilities for healing and reversing the damage caused by trauma. The author discusses 3 avenues for healing: top-down, through talking and connecting with others, medication, and bottom-up, allowing the body to have experiences that contradict the helplessness and rage associated with trauma. The author concludes by discussing their work at the Trauma Center and their dedication to both treating trauma survivors and conducting research to explore the effects of traumatic stress and determine effective treatments. The author emphasizes the need for society to face the reality of trauma, explore treatment options, and prevent trauma from occurring in the first place. 2. The effects of trauma on the brain, mind, and body. This passage discusses the various effects of trauma on the brain, mind, and body. It highlights the correlation between post-traumatic stress disorder, PTSD, and physical illness, as well as the impact of childhood abuse on women's health. The passage also explores the concept of alexithymia, a condition characterized by difficulty in identifying and expressing emotions and its relationship to PTSD. Additionally, it delves into the long-term consequences of trauma, such as dissociation and depersonalization. The passage emphasizes the importance of attachment and attunement in early childhood development and the potential negative outcomes of abuse and neglect. It concludes by discussing the role of love and relationships in healing from trauma. 3. Using psychomotor therapy to rescript traumatic experiences and create new realities. In this passage, the author describes a psychomotor therapy session with a woman named Maria who has experienced trauma and abandonment. The therapist encourages Maria to focus on her internal experiences and uses a witness figure to reflect her emotions and validate her feelings. Through the use of structures where group members represent significant people from Maria's past, she is able to explore her relationship with her father and mother. The therapist guides Maria in expressing her emotions and desires to her parents, both real and idealized versions, allowing her to release pent-up anger and sadness. By creating new experiences and narratives, Maria is able to rescript her inner world and find healing. 4. New approaches to healing trauma. Yoga, neurofeedback, and self-leadership. This passage discusses various approaches to healing trauma, including yoga, neurofeedback, and self-leadership. The passage highlights studies that have shown the effectiveness of yoga in reducing symptoms of PTSD and metastatic breast cancer in women. It also mentions the potential benefits of using devices and computer games developed by HeartMath to reduce PTSD symptoms. Additionally, the passage mentions the availability of apps on iTunes that claim to help increase heart rate variability, HRV, which is associated with improved self-awareness and emotional regulation. The passage also discusses the role of neuroscience research in understanding PTSD and trauma. It mentions brain imaging studies that have shown problems in the areas of the brain related to physical self-awareness in traumatized individuals. It also highlights the importance of interoception, or the ability to sense and understand one's own physical sensations in trauma recovery. The passage suggests that mindfulness meditation and yoga can lead to structural changes in the brain and increased gray matter density, which may contribute to improved emotional regulation and stress reduction. Furthermore, the passage introduces the concept of self-leadership and its role in trauma recovery. It discusses the idea of different personality parts or alters and how they can be addressed through therapies like internal family systems therapy, IFS, and Pesso-Boyden system psychomotor, PBSP. The passage emphasizes the importance of creating structures and frameworks to support healing and mentions the use of neurofeedback as a tool to rewire the brain and improve emotional regulation. It also highlights the potential benefits of neurofeedback in treating conditions like ADHD, epilepsy, and borderline personality disorder. 5. Research and therapeutic interventions for trauma and PTSD, animal-assisted therapy, sensory modulation, and more. The passage discusses various studies and research related to trauma and its effects on the brain and body. It mentions the use of animal-assisted therapy, sensory modulation principles, and trauma-informed programming in the treatment of traumatized individuals. The activation of the vestibule cerebellar system in the brain is also discussed, as it is believed to be involved in self-regulation and can be damaged by early neglect. The passage also mentions the use of different therapeutic interventions, such as parent-child interaction therapy and exposure therapy, in the treatment of post-traumatic stress disorder, PTSD. Additionally, the passage discusses the use of medications, such as fluoxetine and MDMA, in the treatment of PTSD. It also mentions the importance of language and expressive therapies, such as dance, movement therapy, and expressive writing, in the healing process. The passage concludes with a discussion on the impact of trauma on cognitive functioning and the potential for neuroplasticity and healing through various therapeutic interventions. 6. Neurofeedback study shows reduction in PTSD symptoms and improvement in executive function and emotional control. A randomized controlled study of neurofeedback was conducted on chronically traumatized patients, which showed a 30% reduction in PTSD symptoms and significant improvement in measures of executive function and emotional control. Traumatized children with sensory integration deficits require specialized programs, and efforts are being led by colleagues at the Trauma Center and the University of British Columbia. Various studies have explored the relationship between EEG brainwaves and psychological phenomena, including hypnosis, hypnotic susceptibility, and altered states of mind. Alpha-theta brainwave neurofeedback therapy has been found to be effective in treating combat-related post-traumatic stress disorder in Vietnam veterans. EEG biofeedback has also shown promise as a treatment for substance use disorders. Post-traumatic stress disorder is a significant burden to individuals and society, and there are causal pathways between PTSD and drug use disorders. EEG biofeedback training has been found to be effective in treating alcohol and drug dependency. Neurofeedback has also been used as a treatment for opiate addiction. The use of theater and communal rhythms has been shown to be effective in helping homeless Vietnam veterans and exploring the anguish of war for soldiers. Dance and drill have played a role in human history and can be used in trauma recovery. 7. The body keeps the score, brain, mind, and body in the healing of trauma. The body keeps the score, brain, mind, and body. In the Healing of Trauma is a book that explores the impact of trauma on the brain, mind, and body. The passage provides a list of various symptoms and behaviors that are commonly associated with trauma, such as self-blame, self-deceit, self-harming, self-hatred, shame, substance abuse, and suicidal behavior. It also discusses the difficulties that trauma survivors face in terms of trust and attachment, as well as the impact of trauma on children and the importance of caregivers' relationships in predicting adolescent behavior. The passage also touches on the topic of childhood trauma as a misunderstood issue in psychiatric diagnosis, with childhood trauma survivors often being misdiagnosed or ignored by the Diagnostic and Statistical Manual of Mental Disorders, DSM. It mentions the proposed developmental trauma disorder, DTS, and the rejection of this diagnosis by the American Psychiatric Association, APA. The passage also briefly mentions the use of cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, in the treatment of trauma, as well as the role of medication and non-Western medicine. Overall, the passage highlights the wide range of symptoms and behaviors associated with trauma, the challenges faced by trauma survivors, and the need for a comprehensive understanding and approach to trauma healing. 8. The unbearable heaviness of remembering. The frequency and importance of seduction. in childhood. Experiences. In this passage, the author reflects on their previous paper on the etiology of hysteria and admits to exaggerating the frequency and importance of seduction in childhood experiences. They acknowledge that seduction is not necessary to arouse a child's sexual life, as it can also occur spontaneously from internal causes. The author also notes that fantasies of being seduced are often not just fantasies, but real memories. The passage then transitions to discussing the impact of trauma, specifically in relation to World War I and shell shock. The author references various studies and books that explore the aftermath of the war and the psychological effects it had on soldiers. They also mention the work of Army psychiatrist W. Rivers, who wrote a trilogy on the subject. The passage concludes with a discussion on the treatment of trauma and the importance of self-leadership in healing. The author mentions various therapeutic approaches, such as mindfulness meditation, yoga, neurofeedback, and animal-assisted therapy. They also highlight the role of body awareness and the connection between the brain and body in trauma recovery. The passage ends by emphasizing the need for trauma-informed programming and interventions that address the specific needs of individuals who have experienced trauma. 9. Exploring the impact of trauma on the brain and body. This passage provides a comprehensive list of various topics and concepts related to trauma and its effects on the brain and body. It mentions the use of painkillers and panic attacks in trauma survivors, as well as the role of the parasympathetic nervous system in regulating the body's response to stress. The passage also discusses different therapeutic approaches, such as parent-child interactive therapy and psychomotor therapy that can help individuals recover from trauma. It highlights the importance of feeling safe and the challenges trauma survivors face in establishing trust and intimacy. Additionally, the passage touches on the prevalence of PTSD in different populations, including combat veterans and survivors of accidents and disasters. It also mentions the role of memory and language in trauma recovery, as well as the potential benefits of practices like yoga and mindfulness. Overall, the passage provides a broad overview of the various aspects of trauma and its impact on individuals.